Gil, would you show me the pattern of the heart flow, the blood flowing through your body? Can you show me that? And I thought, well, sure, I can show you that. And so I made this motion up with my arms to demonstrate the flow or the passage of the blood through our bodies. But it's, of course, a rough approximation given the complexity of it all. But it does give sort of a built-in kinesthetic sense of the pattern of blood flow through the heart. So thank you for asking, Anne-Marie. It's my pleasure to share this with others as well. So basically, if we were to start up high like this, right? High and low, we'd have the superior vena cava and the inferior vena cava. And those are the pathways into the right atrium of the heart in the center of the chest. So here comes the blood into the right atrium and then into the right ventricle and up through the pulmonary trunk, out the pulmonary arteries to the lungs. And from the lungs we return through the pulmonary veins to the left atrium, down into the left ventricle, and then up through the aortic arch and out to the rest of the body. Now, half the fun of this is the fact that you don't really know what you're doing. And that what we have is a different motion every time. One of the key indicators of heart health is heart rate variability. We never want our hearts to be moving exactly the same way over and over again. It's a dynamic motion. It's a motion of the whole body. The heart as an organ infiltrates every layer of your body, clear out to the tiniest capillaries in your fingertips, throughout your viscera, clear to your toes, through your brain, to the crown of your head. The heart has no limit.
The incredible journey of life, from birth, through infancy, childhood, puberty, adulthood, and a slow maturity to old age. This is the story of our lives from a unique perspective, deep inside our bodies. This is the journey of a human life, from the outside in.
Okay, 3 stressors are causing the destruction of our kids: physical, chemical, and emotional stress. So that's the start of the world. Then they're brought in antibiotics for ear infections, genetically modified foods for their baby food, which destroys the gut. This is where serotonin's produced. And then, since they're They need constant input because they have damage to their brain. They're glued to their cell phones or little iPads. I'm getting so many kids now in with ulcerative colitis and Crohn's disease, with neck trauma on a 7-year-old, Crohn's disease on an 8-year-old. This is insane. Let's change this world. Let's take it back. Humans were never this violent. This is Dr. John Bergman. God bless you, and I love you.
Greetings. My name is Gil Hedley, and I'd like to thank you for your interest in the Integral Anatomy series. I intend to reveal and explore with you in this volume the layers of the human form which follow and build on our discoveries in Volume 1, Skin and Superficial Fascia, and Volume 2, Deep Fascia and Muscle. The human form is an integrated whole. There are no parts to the living form. Parts are merely the renderings of the inquiring mind and artifacts of the anatomist's scalpel, which reduce the form to its bare bones in the quest for understanding what lay beneath the skin. My ultimate goal is to create a deeper felt and lived experience of the whole, more so than to measure the parts. As we sharpen our perception and appreciation of the details of whole body layers, continuities of texture, and the repeating patterns of our form, we increase our range of motion and maximize the potential of our human experience. We take a moment now to express our gratitude to the donors and their families who make study at this level possible. Good.
Am I good?
Yeah. So, here's the thing about the fuzz. I'm going to try and do it at count. Okay. So, we've seen the fuzz. You can see it now. I'll put it in over my voice. The fuzz yields to my fingertip. Sometimes I come across a stronger, thicker strand that doesn't yield to my fingertip. That represents older fuzz sometimes, or maybe it represents a nerve. But each night when you go to sleep, the interfaces between your muscles grow fuzz, potentially. And in the morning, when you wake up and you stretch, the fuzz melts. We melt the fuzz. That stiff feeling you have is the solidifying of your tissues. The sliding surfaces aren't sliding anymore. There's fuzz growing in between them. You need to stretch. Every cat in the world gets up in the morning and it stretches its body and it melts the fuzz in the same way that the fuzz melted when I passed my finger through it. When you're moving, it's as if you're passing your finger through the fuzz, just like I did on the cadaver form here. So you have to stretch and move and use your body in order to melt that fuzz that's building up between the sliding surfaces of your musculature. The sliding surface, those shiny white surfaces of the rectus femoris sliding against the vastus intermedialis. So these sliding surfaces are all over your body, and the fuzz is all over your body, and as you move, you melt the fuzz. Now what happens if you get an injury? Ah! My shoulder! My shoulder is stiff now. I'm holding my shoulder. I go to bed. I wake up in the morning. I don't stretch my shoulder. I'm afraid it hurts. So I'm walking around like this. Last night's fuzz doesn't get melted. I go to bed. I sleep some more. Now I have 2 nights' fuzz built up. Now 2 nights' fuzz is more fuzz than 1 night's fuzz. What if I have a week's fuzz or a month's fuzz? Now those fuzz fibers start lining up and intertwining and intertwangling, and all of a sudden you have thicker fibers forming. You start to have an inhibition of the potential for movement there. It's no longer simply a matter of going, ooh, ah, stretch. Now you need some work. Now you might need to do a more systematic exploration of that place to restore the original movement that you lost. And usually this is the case. We have a temporary injury, then we restore our movement. But sometimes we call this aging. The buildup of fuzz amongst the sliding surfaces of our bodies so that our motion becomes limited, the limit cycles become introduced into our normal full range of motion, and we start to walk around like this. We're all fuzzed over. Our body is literally solidifying. We're reducing our range of motion in individual areas of our body and for our entire body in general. So I believe that one of the great benefits of body work, whether it be massage or structural therapies or physical therapy or any kind of hands-on therapy, these types of therapies introduce movement manually to tissues that have become fuzzed over through lack of movement, whether the lack of movement is because of an injury and a person is protecting that injury, or because of personality expression. That was many years when I just walked around like this. I was very still and monk-like. So, and then I became a little more dynamic in my personality when I realized what I was doing to myself and the kind of life that I wanted. So you can grow fuzz by choice or by accident or whatever, and yet here, now you've heard the fuzz speech, you know that you can take responsibility for melting the fuzz, and if there's too much fuzz in your body and it's frozen up, you might want to seek help in order to introduce movement so that the new cycle is a little more movement and a little more movement and a little more movement instead of a little less movement, a little less movement, a little less movement. Fuzz represents time. The easier it is for me to pass my finger through the fuzz, the less amount of time it's been there. If I got to whip out my scalpel to dig my way through one otherwise sliding surface and another, you know that that's been building up for a long time. So you can actually see time in fuzz. That's the fuzz speech.
Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release.
To really treat the body, you need to understand the normal program in the body, how the body works. If you really don't know how the body works, you cannot treat it. When you have inflammation or injury, your voltage in the cells goes down to 5 to 10 millivoltage. So how to transition that to charge the cells so the cells will start to do what's supposed to do. Because if you have deficiency, does not matter how much magnetic force will apply or charging the cells. If you have deficiency on D or B or other nutrient, this magnetic will not be effective because you don't have the fuel that the magnetic will use to help the cell.
Does fascial manipulation help those who have had hip replacements or have a limited range of motion?
That's a great question. So let me answer the hip replacement one. Do you think anyone gets their hip replaced while having optimal alignment and their mechanics and their fascia just top-notch? No, right? No one ends up with that surgery while everything is going fine. So it's actually extremely important, and we work with this, to come and see, Dr. Rob and Dr. Sor for some regenerative stuff and to realign your fascia so you simply have better success. Yes? Because this is the analogy I use. Imagine going to, taking your car to the mechanic because the alignment of your car was off and you rubbed out a tire. Well, yeah, you're going to want to replace that tire, right? But can you imagine slapping on a new tire, which is the equivalent of a hip replacement, and leaving the alignment like that and walking out the door? Right? So, yes, you want your fascia work, and it's going to also prevent issues that might be caused just from the surgery, from the recovery from the surgery. The other part of the question, Renee, again, sorry?
The rest of it was...
Long-winded.
Oh, what about hip replacement or limited motion?
Limited motion, yes, but did you see that where I caused the fascial restriction wasn't necessarily what restricted the motion in a whole bunch of other spots? So my answer to that is please go to get evaluated properly, because if you release the wrong spot, believe it or not, you might not get any result, or you might get adverse results. So be mindful with that. Fascia's kind of tricky. Don't just release where it's hurting. Could be coming from somewhere else completely, okay?
Thank you.
If you release the wrong spot, believe it or not, you might not get any result, or you might get adverse results. So be mindful with that. Fascia's kind of tricky. Don't just release where it's hurting. Could be coming from somewhere else completely, okay?